To part one of two demos this week. I misspoke earlier. I thought I just had a demo Wednesday, but we got one today too. So today during the demo, what we're going to talk about is the class 4 therapeutic laser and show a little bit of the soft tissue involved in what Kevin got going on today. So Kevin been working his butt off the past couple weeks here. Well, ever since you started, but he is having a little bit of lateral epicondylitis pain, or commonly known as tennis elbow. So what we're going to do today is I'll basically just show you how the laser treatment works. And then we're just going to do minimal soft tissue today, and then tune in Wednesday at 1 p.m. because we're going to go a little bit more, a little bit deeper into what we do with that grassing tool, so the scrapey tool, what we do with the cups, and then different kind of stretching and trigger point releases. So to get started, usually when I laser people, I like to put a little bit of our topical CBD on just because it's the transdermal cream with the lipoderm technology. So it is not placebo CBD. So it's not going to be the kind of CBD that you're going to get at the gas station, at different stores, just because this uses the same technology that most endocrinologists use when women go through hormone replacement therapy. So if you have any family or loved ones, any friends that, hey, I went through menopause and I ended up going on estrogen or progesterone. When you go to an endocrinologist and they actually have you put the topical lotion on, same kind of technology. So this truly works and truly gets into the tissue. So what we're doing right here is we're going to get some CBD over Kevin's. It's called your lateral epicondyle, which is basically the bone where all the muscles on the extensor portion of your forearm attach. So Kevin's been pretty busy, using his hands especially past 2 weeks. So what we're going to do is we're going to try and loosen up some of the muscles that are going to be attached into that lateral epicondyle, that bone. So when we talk about laser therapy, there's a ton of different classes of lasers. So you got class 1 up to class 5 lasers. This is a class 4 therapeutic laser at a 910 nanometer wavelength. All that means is we are using photon energy from this laser basically to increase how quick Kevin could heal. So we're going to increase his healing capacity close to 100 times normal what he would normally heal at. So couple contraindications to laser therapy. Can't be pregnant and can't laser over a malignant tumor, a spinal cord stimulator, or a pacemaker. Besides that, you're basically good to go. So this is probably one of the best things that you could do. That's going to be non-invasive, so you could increase your healing capacity. So we're going to get right after it. And Kevin, as usual, if it gets too warm, let me know, okay? So, and I don't know if they could see on the video, but it basically just looks like a warm light. And the cool thing about our laser, we got the Rolls Royce over here. This is one of the newer ones on the market. And why we needed the big dog, so to speak, is because this is a 60 watt laser, which basically, if you look in the greater Pittsburgh area to other different like chiropractic facilities, DO, PTs, a lot of them actually use like a class 3B, which is kind of like a cold laser. So it only actually goes up to 30 watts. So this is literally double the wattage, just so you could kind of increase or decrease the time it takes you to get better. And this is actually what's called a continuous laser as well. So when we were talking about the class 3B cold laser, usually it's pulsed. So for every second that it treats, it takes a second off, and this is a continuous. So in 2 seconds, you're going to get 2 seconds of treatment instead of it just kind of like alternating 1 second on, 1 second off. So people, they respond way quicker than a cold laser when they get this one too. And a lot of time, very common question people will always ask, well, I have a disc herniation. What's this doing for my disc herniation? That's like in my back. Well, this laser actually penetrates 2.42 inches into your tissue. So when we're talking about any kind of like disc herniation or disc bulge, you could think of, actually, I'll just have to show, actually, Kev, give me 1 second here. I'll just show a quick depiction here. So when we were talking about any kind of disc bulge or disc herniation, so long story short, this laser, massive anti-inflammatory purposes. So long story short, this is your jelly inside your jelly donut. So you have, it's called your nucleus pulposus inside the annular fibrosis. over time, you have 22 to 24 layers of the donut here. And over time, you could have micro tears and they kind of break. So what happens is when you have a disc bulge or a disc herniation, you have a full tear of that and then your disc bulges. And what inside the disc, you have 8 main inflammatory proteins. We'll just call it chemical soup. So when that chemical soup comes out and hits the nerve and irritates it, the nerve actually swells 3 times its normal size. So this is what a normal nerve is going to look like. And then a pathological nerve, so like inflammation around the nerve, it's going to swell 3 times its normal size. So the cool thing again about this class 4 laser is it actually penetrates 2.4 inches into the body. So when everybody's like, what are you going to do for that disc herniation to get the inflammation down? That right there, because it'll actually get to the target tissue at need here. And they actually gave us a second for this to cool down because this gets kind of hot, Kevin. Yeah, so to talk more about how this actually works, so the best analogy for laser therapy is just how sunlight hits a plant for the plant to grow and heal. We're donating photon energy from the laser to the cells in Kevin's forearm just to increase his healing capacity, and that does it by a couple different things. So it allows for an increase of nitric oxide and O2 perfusion across the cell membrane. And then if we go back to 8th grade biology, the mitochondria, the powerhouse of your cell, this is going in, hitting something called a chromophore. It's like a photosensitive receptor in the mitochondria, and it allows for more ATP production. So what's that mean? He's going to create newer, healthier cells and more energy for his cells to heal. And you could use this on a variety of different pathologies at hand. So, for example, it works really good for his lateral epicondylitis or tennis elbow, plantar fasciitis. Works good for Achilles tendonitis, works good for any acute muscle strain, any joint sprain. There's a setting on it for actually shingles, believe it or not, diabetic radiculopathies. And it basically just helps all processes in the human body just to accelerate so you get out of pain quicker and more importantly, that you actually heal quicker. And a lot of times people always ask, is this temporary or permanent? This is actually a permanent effect. This will actually change your cells at the physiological level for a permanent change. Not too warm here?
Yes.
Okay. All right, so we got another about 30 seconds. We're going to laser Kevin here. Yeah, and the cool thing about having the class 4 hot laser is the only byproduct from the laser therapy is heat. So when we get collagen, so all the skeletal muscle here is all collagen based. Once this gets heated up to around 100 degrees, it becomes a little bit more pliable or mendable. So same principle as if you're going to try and bend cold rubber as opposed to warm rubber. It just makes it a little bit easier to treat the affected tissue. All right, we're going to go 5 more seconds, Kev. Okay, good. So you can relax this arm here for me, sir. And then, Kev, I will take your glasses here for you. Thank you. Appreciate it. All right. So that was basically what we do for the laser therapy. Now, depending on what someone's coming in for, depends on the duration of how long we laser and the wavelength. What we were talking about, this laser has different basically preset treatment options for like large joints, medium-sized joints, small joints, shingles, actually TMJ it has a setting for, and there's just so many different things you could treat with it. So what we're going to do now, since Kevin's tissue is nice and warm, so we're going to do is called basically like a pin and stretch here. So I'm going to see, Phil, can everybody see here? A little tough. Sorry, Phil. Okay, so what we're going to do next is we're going to work on Kevin's forearm right here. So again, basically lateral epicondylitis or tennis elbow, what happens is it's kind of an overuse injury of your forearm. So Kevin, for multiple hours a day, is just doing a lot with his hands and moving boxes, setting everything up. So it's going to tax these muscles, and these muscles are going to get very, very tight. When the muscles get tight, they pull on that, what we were talking about, that lateral epicondyle, basically the origin of all these muscles. So what happens is the more he uses his forearm and the tighter it gets, the more tension from the tendons and the muscles are going to be pulling on this lateral epicondyle, and then he starts to have pain. So we gave him some good topical CBD and then photon energy from the laser, and now we're going to do something called pinning and stretching. So what we're going to do is we are going to shorten the muscle in his forearm. We're going to pin it, and then we're going to stretch it back out. Sorry, Phil. Okay. So again, so we're going to shorten the muscle, pin it, and stretch it. You okay here? Mm-hmm. And if I push too much, let me know. I've been told that sometimes these thumbs are a little too strong. A little too strong. So, and patients get great results with this. So like, I don't know who tuned into my 10 a.m. slot, but I'm a chiropractor. I love adjusting patients. However, if you just adjust certain joints in the body, you have a ton of tendons, ligaments, and muscles attaching to these joints. So if we just adjust it and don't work on the soft tissue, you're basically missing half the battle. So not only do we adjust Kevin's elbow, but we actually want to make sure we do some of the soft tissue, especially in this situation here. So lateral epicondylitis, the suffix itis meaning inflammation. So what I would have Kev do is at home, take any kind of natural anti-inflammatory. I know he likes the X-Flame. So we'll get him taking an increase in his X-Flame. And then we're also going to do the CBD, and then we treat him. And Kevin, last time you had a flare-up of this, how many times we treat you and it felt better?
2.
Yeah, two treatments. It's not like when you go to other chiropractors and they're like, you need to come in 3 times a week for this whole month and then twice a week for the next month. Not the case. We usually see results in just a handful of treatments, to be honest with you. And we're going to go 5 more, 3 more, 2, last one. Good. And then we're going to work on the flexor portion. So we're going to go dead weight here. I got you. So some practitioners term this active release technique. I just call it pinning and stretching. So we are basically just trying to put more length in the muscle so it's not pulling on where it inserts and originates on the bone here. So we're going to go 5 more. Last one here. Very, very good. Just a little push here. Good. A little push right here. All right. So all in all, that is basically like what the laser does in a nutshell there. That was just kind of an example that we did with Kevin's elbow. Again, I mean, I almost use it on not every single patient, but a majority of the patients just because of what it does for anti-inflammatory, what it does to the tissue, and we're getting really, really good results with it. So if anybody has any questions about the laser, feel free to call in. My lunch is like 1 to 2. Give or take, and I could always try and give you a call back on my lunch break and answer some questions. But yeah, that's a fantastic modality that people are getting absolutely crazy results with. So whether it's you are in pain, whether you have any kind of dysfunction, doc, I was able to do this 5 years ago, but I can't now because I'm limited from my shoulder, my knee, my hip. Come in, we'll go through a thorough assessment to see exactly what's going on with you. Get you treated. And I can't make any guarantees, but I would say almost every single person does not leave here feeling worse. You have to feel better leaving here. We get results. This isn't placebo. So come in and get checked out and check us out, guys. So sound good? All good. Thanks, Phil.